Have you ever woken up unable to move your whole body? Like your eyes are open, but you know that your body is just not cooperating. Now, if I tell you that you are not alone, if I tell you that 8% of the people in the world suffer from some form of sleep paralysis, would that make you feel better? Probably not. We'll talk about some causes and how to avoid it. But I remember talking to a patient of mine, and that was their chief complaint. Like, doc, every now and then, now it wasn't an everyday thing, thank the Lord. But every now and then they would wake up, their eyes would open, but it felt like their body hadn't caught up yet. Like, you get out of the dream. So you're expecting like, all right, I'm out the dream, time to get up and go. I hear my alarm clock, but your body is absolutely not cooperating. And what may feel like forever may only last for, a few seconds. But for most people, that is a few seconds too long. So today we're going to talk about sleep paralysis. We're going to talk about what are some of the common causes associated with sleep paralysis. And hopefully after this video, you'll have some tips on how to avoid it altogether. I'm yours truly, Dr. Barry Pierre, host of Medicine Mondays, and let's talk about sleep paralysis. So what is sleep paralysis? It's something that affects about 8 to 10% of the population. It actually occurs between the periods of wakefulness and sleep during your REM cycle, right? So there is a certain time frame when this occurs, and how it's typically described as the physical inability to make any movements. The brain has turned on. You want to, again, you can't even open your, and I'm not saying like gross motor function. You can't even open your eyelids. But what's worse is during this time frame, if you are able to open your eyelids, all of a sudden there's like hallucinations everywhere, right? You start seeing shadowy figures. You start hearing things. Does that ring a bell to anyone who's especially watching this? And that is where the fear comes in, because for a brief period of time, there are visual and sometimes auditory hallucinations associated during this time frame that you almost can't do nothing about. And you want to scream and shout, but no one can hear you. So you just scream it to yourself. And then eventually you kind of snap out of it. And eventually you're just like, you're so startled from what happened. Guess what happens? You try not to go to sleep. You try to avoid sleep altogether. And I want to talk about a patient of mine's, a young lady. She was in her teens and came into the office when I was doing outpatient medicine. And her issue was, doc, I'm having trouble sleeping. I'm dealing with insomnia, right? So I'm having trouble sleeping. But especially when you're typically talking to patients with sleep issues, a couple of things you try to get all together, right? And we'll do a little sleep help hygiene during this episode. When I hear someone has trouble sleeping, first thing I'm trying to figure out is, one, what time do you go to sleep? What time are you going to bed to start the sleep process? Two, what are you doing prior to going to sleep? You'd be surprised how many people are ripping and running and think that, second they plop in the bed, they're ready to go. Number three, where are you trying to sleep, right? Which is, I think, is extremely important. A lot of people don't think about this. There are a lot of people who will do everything in their bed. They watch TV in their bed. They eat in their bed, right? They're doing homework in their bed. They're doing work in their bed. Like, they're just doing so much things in their bed. And then when it's come time to go to sleep, right, they're wondering why their body isn't recognizing that it's time to go to bed, right? Because your body has a discordance of, hey, like the place that I'm at right now is actually supposed to be for sleep. Because your body just recognizes and your brain recognizes that every time you're in this area, this location, this bed, you're either eating, watching TV, you're doing something else other than sleeping. So how am I supposed to know that this is the time that I'm supposed to turn my brain off? Right? So think about that, right? So she comes in, she tells me about, her sleep history, problem sleeping. And then when I really start digging in, that's when she lets me know, like, yeah, doc, sometimes like my body just freezes and like I can't do anything. I feel people are staring at me, but for those few seconds, like I just can't move. And then eventually I like jolt myself out of it. So when I'm doing my history and I get that piece of information and I ask her like how she feels about it, how she feels during it afterwards, like you start digging into the fact that like, okay, not only is she having these brief issues of sleep paralysis, but I think that's attributing to her poor sleep, right? Because now she's thinking about these instances of like, oh my God, is this going to be a night where I wake up paralyzed and I can't move, right? And again, that's because that's exactly what you feel. Like you can't move your arms, you can't move your legs, you can't move nothing. And then again. So it'd be one thing if this were occurring, but it's silent in the room, nothing's going on in the room. Again, it's usually dark, right? So your brain just starts like trying to imagine what's going on in the dark as it's trying to get adjusted. And you can't move and you're scared, and that causes you the lack of sleep. That causes you to have trouble sleeping later than normal. Like that causes all these issues here. And then lo and behold, we're having issues with chronic sleep paralysis, right? So that's kind of the introduction, right? When we think about sleep paralysis, one, I don't want you to ignore, but sometimes we talk to our family, we'll say, hey, I think this is going on. We'll kind of brush it off like, stop it. Like, go out of here, like you're okay. And we try to brush it off. But yes, this is a real thing. Like I said, it affects about 8 to 10% of the population. And it's something that if you are not thinking about, especially as a clinician, if you're not thinking about it, then you don't have any way to really help get your patients from point A to point B, which is feeling better, feeling safe to go to sleep, and more importantly, getting the adequate sleep, as we talk about some of the causes associated with this sleep paralysis. All right, so when we talk about some of the common causes, I kind of alluded to it with my patient example, right? So here is someone who was having inconsistent sleep because she had very poor sleep hygiene. So when we think about sleep paralysis and some of the most common causes of sleep paralysis, you have to get to the bottom of their sleep hygiene, right? Which again, I think it's definitely something that doesn't get talked about a lot. A lot of times when we talk about sleep and sleep-related disorders, sleep apnea seems to be the big thing, right? Everyone talks about sleep apnea, a little bit of snoring, but sleep apnea seems to be the big thing that gets a lot of the attention. But sleep hygiene is such an important component. You will hear, if you have high blood pressure, you need good sleep. You have diabetes, you need good sleep, right? If a lot of medical related diseases, I'm not saying is caused due to poor sleep. I'm just saying it's going to be much more difficult to treat if you aren't getting a good night rest. Right. And of course, it's going to sound wild because to some people, you almost need about 6 to 8 hours of good, restful sleep, right, to try to avoid this aspect. Right. So we know a big thing is dealing with poor sleep hygiene. Right. Now, when we think about other issues associated with sleep hygiene, and more importantly, sleep paralysis, we got to start thinking about like just our anxiety level and just the stress levels in and of itself. A lot of us are bringing stress and stressors to our home, to our bed, whether it's coming from inside the home, outside the home, we're bringing it all the way till it's time for bed, right? Like we're not giving it any time to offload elsewhere. And when you're dealing with an increased level of stress, when you're dealing with poor related sleep, you're going to be more anxious, you're going to be more uncomfortable, right? And these are all kind of be wrapped up in one, adding to, right, this issues associated with the sleep paralysis. So we can't even talk about treating your sleep paralysis if that's a thing, right? We can't even talk about it until we talk about the causes. So until you know and understand, hey, what are my causes? Do I have good sleep hygiene? Am I making sure that when I go to my bed and lay in my bed, it's only for sleep? Am I making sure that I'm not eating or drinking things that may keep me up, aka caffeine, aka alcohol, aka things that may affect my sleep cycle? Am I doing the things that are allowing me to kind of de-stress myself before it gets to the point where it's time to go to bed, right? We say this all the time. If you go to bed angry, a lot of times you don't have a good night rest, right? Because again, you're dealing with a lot of stress-related hormones, especially when you're angry and you're sad, you're depressed, that cause you not to sleep. So it's one of these things where you have to have, especially encompassing a good sleep hygiene, understanding that there are so many different factors associated with like good sleep hygiene. We should do an episode on that. Put it in the comments if you want me to do an episode on sleep hygiene. We got to have a good foundation of sleep if we actually want to make sure we're sleeping, right? And there are actually some studies that shown that position, how you sleep, causes an issue as well. Most of the time, if you talk to people who deal with sleep paralysis and you ask them, hey, what position were you in when it occurred? A lot of times they're laying on their back. They're laying on the back, looking up, and then the sleep paralysis hits them and they can't move. You don't get too many people who say, I was laying on my side, right? And then the sleep paralysis got me. It's usually they're laying on the back. But again, it's not 100% because I don't want people to be like, well, I'm a side sleeper, I can never get sleep paralysis. It's not true. Right? I sleep on my stomach, I can never get sleep paralysis. It's not true. Right. But there is some correlation associated with position. And the most common position, just sleep in general, is sleeping on the back, which again, associated with sleep paralysis. Right. So these are some things that I just want us to think about as we kind of lean into this aspect of causes, but more importantly, the treatment. And I think the treatment is really kind of self-explanatory, right? You have to deal with said causes. You have to understand that, hey, if I am going to have these issues coming in to the sleep, of course, I'm going to have poor sleep. Of course, it's going to be a poor sleep cycle. And of course, it's going to increase my risk of dealing with an instance where I am in brief period of sleep and wakefulness, and then boom, that's when it happens. So if we have to think about, and when I talk to my patients, I always say we have to kind of think backwards in medicine. In medicine, we think backwards, but we just kind of tell you in the beginning, right? So when I have a patient with high blood pressure, diabetes, high cholesterol, I'm thinking about some of the end causing products and say, all right, how do I work back to get to the point where it's controlled, right? How do I work back to get to the point where your blood pressure is controlled, where your blood sugar is controlled, right? Where your cholesterol levels are in range? Like, what do I need to do, like, forward thinking to get you to that point, right? So it's extremely important when we think about, this sleep paralysis and really how, again, not to say deadly, right? But it's extremely, extremely scary, right? Like I suggest, go ahead and just Google, right, sleep paralysis and see some of these people's stories when you hear about it, right? It is not something that is for the weak. It is not something that you say, oh, they're just anxious. Of course, they're going to sleep apnea. No, it is something that can be very terrifying when it occurs, right? Again, like I said, just think about this. If for 5 seconds you were able to open your eyes but couldn't move the rest of your body, you'd be scared. That would be the longest 5 seconds probably in your life if that's what you were waking up to unexpectedly. Understanding that, yes, this is an issue that really needs to be addressed, really needs to be just kind of talked about. First of all, you dealing with sleep paralysis, there is no supernatural force that's causing you to have sleep paralysis, right? There's usually science, behind the issue that you're dealing with. Understand, again, we can't downplay it. Right. So if you experience an episode, once every 2 weeks, once every month, once every couple of months, right, it is something still important to talk to your healthcare provider about. Still need to talk to your doctor, even if it only occurs once. Yes, it may be benign. Yes, it may be short-lived, but that's a level of stress and anxiety that you shouldn't have to deal with. And a lot of times it's a precursor of things, right? It's a precursor, like, okay, you're having a sleep paralysis issue. Okay, there's some sleep hygiene related issues. Oh, if there's sleep hygiene related issues, let's make sure we're not missing something that could be affecting the sleep hygiene that could be adding to the problem, right? So extremely important to understand that, as in conclusion, as we think about sleep paralysis and like how scary it is, one is acknowledging, yes, it is very scary. Yes, it is very frightening to wake up and for 3-5 seconds not be able to move your body. Then when you tack on the fact that there's usually some visual hallucinations associated with it, yes, it's very scary. We're not going to sugarcoat and act like this is not a scary issue, but it is an issue that with the right dedication, as far as just kind of conversation with you and your provider, understanding, hey, what are some trigger points? What are some things you could do to try to avoid to get to the point where, I'm having a restful sleep? Like it is worth it having that conversation, going through that sleep journey. I think it is something that really needs to get addressed and talked about, especially as we know that 8 to 10% of the population are dealing with it. If you are suffering from sleep paralysis, or someone from sleep paralysis, does this episode help you? Right? Like, give some tips, leave it in the comments. If you're from my podcast listener, shout out to y'all. Make sure you leave it in the comments, 5-star reviews everywhere. Wherever you see me, you should like and comment and share anyways. But it's more important for us to make sure that you guys are getting information appropriately, right? So you can take to your provider and say, hey, I just watched Dr. Berry. He broke it down, sleep paralysis. This is what I think I'm dealing with. What do I do next? And I'll see you guys next week.